Chapter 4 Human Health by Nuha Raihanah Binti Asman, Mawar Fathimah Raudhah binti Muhammad Khairul Shazwan, and Aliya Maisarah binti Muhammad Puzi. We are from Ikram 2021. Chapter 4 What are the differences between infectious and non-infectious disease? How do infectious disease spread? How are the microorganisms that enter the body killed? Infectious and non-infectious disease. Infectious disease caused by infection of pathogens directly through mediums and vectors. Example, tuberculosis, flu, ringworm, tinea, leptospirosis, dengue fever, malaria fever, and Zika fever. A disease that can be transmitted from one individual to another. Non-infectious disease caused by genetic factor or lifestyle, example, cancer, hypertension, diabetes, asthma, and cardiovascular disease. A disease that cannot be transmitted from one individual to another. How are infectious diseases spread? Infectious diseases are spread by pathogens, the organism that cause disease. All viruses, some bacteria, protozoa, fungi, and worms are pathogens. How can we prevent infectious disease like flu? We need to wear a face mask to cover our nose and mouth. If not, others can catch the flu. Infectious diseases are spread by pathogens transmitted from an infected person, host, to another person through vectors and mediums such as water, air contact. The host is a victim who is weak and easily infected. After getting infected, the host will show certain symptoms of the disease. Airborne disease. Droplet transmission. Pathogens containing droplet sprays from the mouth and nose of an infected person through sneezing, coughing, talking, yawning, or breathing. Dust transmission. Bacteria in the spit, saliva of an infected person dry up and form spores which are spread together with the dust in the air. Airborne disease can be prevented by practicing the following ways. Cover the mouth and nose when sneezing, coughing, or yawning. Do not spit everywhere. Avoid being in crowded place. Ensure the living place gets enough light as ultraviolet rays can kill certain microorganisms in the air. Waterborne disease. Infection through water usually happens in areas inadequate water supply, poor sanitation. Floods also can spread infectious disease. Transmitted through water, cholera, typhoid, amoebic dysentery. This infection can be prevented by the following ways. Add chlorine into swimming pools and water supply systems. Build toilets with good sanitation. Boil drinking water. Wash hands with soap. Infection of disease through contact. Two examples of disease, ringworm, tinea, both are fungi. Infections to occur. Touching the infected skin, wearing the clothes an infected person, disease like syphilis and gonorrhea can spread through sexual intercourse. These diseases are present in body fluids such as semen and vaginal fluid. HIV virus that can cause AIDS can also be transmitted through sexual intercourse, blood as well and among drug addicts. Infection of disease through vectors. Vector, cockroach, fly, Aedes mosquito, Anopheles mosquito, and rat. While pathogen, Salmonella typhi, dengue virus, Zika virus, Plasmodium malariae, and Leptospirosis bacteria.
The table shows the several types of diseases, symptoms, pathogens, vectors, and ways of infection. Disease malaria. The symptoms is shivering, fever, and sweating. The pathogen is Plasmodium malaria. The vectors is female Anopheles mosquito. The way of infection is mosquito bite. Disease cholera. The symptoms is diarrhea and vomiting. The pathogen is Vibrio cholerae bacteria. The vectors is fly. The way of infection is contaminate food and water. Dengue. The symptoms is joint pain, fever, headache, and watery eyes. The pathogen is virus. The vectors is Aedes mosquito. The way of infection is mosquito bite. Zika. The symptoms is fever, rashes, joint pain, and conjunctivitis. The pathogen is virus. The vectors is Aedes mosquito. The way of infection is mosquito bite. Typhoid. The symptoms is fever, intestinal bleeding, and red rash. The pathogen is Salmonella typhi bacteria. The vectors is cockroach and fly. The way of infection is contaminated food and water. The last one is leptospirosis. The symptoms is fever, headache, and muscle pain. The pathogen is Leptospira sp bacteria. The vectors is rat. The way of infection is contaminated soil, food, and water. How do vectors spread diseases? Mosquito first has pathogens in its salivary glands, sucks the blood of an uninfected person. Second, the mosquito secreted saliva when sucking the blood to prevent blood clotting. Infection spreads through the person. Third, another mosquito bites the infected person, transmit to disease to another victim. Fly first has pathogens on its legs and body. Second, the fly transmit the pathogens to the food. Third, the pathogens enter the body of the person who eats contaminated food. The mechanism to prevent the spread of infectious diseases. How can infectious diseases be prevented from spreading? Primary stage. First, improving health. Improving personal family hygiene, cleanliness of living places, and sanitation system. Second, strengthening the body's defense system. Getting vaccine and immunization for babies, children, pregnant women, food premises operators, Haji pilgrims, and travelers. Third, frequent health checkups. Fourth, maintaining a healthy lifestyle such as inhaling clean air and eating a balanced diet. Secondary stage. First, determining transmission of infections through active and passive case detection, giving early treatment to patient and separating patient from other. Tertiary stage. First, controlling vector population, destroying vector breeding and hiding places, fogging to kill vectors, enforcing laws by issuing compounds to owner of dirty food premises. Second, protecting hosts using mosquito nets or mosquito coils and wearing thick clothes. Body defense. Pathogens enter the body through the respiratory system, digestive system, excretory system, and skin. You guys can look at the picture. This is how the process takes place. Importance of immunization. This picture is show the importance of immunization. Passive immunity and active immunity. This picture is also show what is passive immunity and what is active immunity. Strong immune system causes that weaken the immune system. Exposure to polluted air, exposure to pesticide, stress, and excessive intake of sugar. The practice that strengthens the immune system, getting enough sleep and rest, exercising and inhaling fresh air, not smoking and not exposure to cigarette smoke, and doing periodic health examination. The end. That's all for us. Thank you.